It's conceivable. We have conducted a study and we published a couple of years ago the PIN trial. And this was a study in which we took patients who had robust responses, partial responses to chemotherapy, platinum-based therapy, and then they were randomized in a placebo-controlled trial to a PARP inhibitor or not. Now, these, again, were not patients known to be enriched with BRCA1, BRCA2, classical mutations that affect homologous recombination and should sensitize to PARP inhibitors. However, we saw some signals, particularly in the squamous lung cancer population. And based on what we're observing in mesothelioma outside of the classical indications for PARP inhibitors, one does wonder actually whether this biology is also applicable. So I think ultimately, if we're able to select patients who are likely to respond, these are the patients with this skin gas interferon alpha signal, it's whether or not that applies in other contexts that wouldn't classically be associated with the homologous recombination deficiency signatures that we see with BRCA1, BRCA2. So this is all, of course, hypothetical, but the evidence at the moment from the trial is intriguing and certainly something we want to study a bit more.